So today I'll be talking about how to read a molecular testing report, and to understand, how to interpret the molecular testing report. I think that it's important just to have a little bit of background of what genetics is. And as Dr. Sen had talked about in her talk, as far as what DNA is, that's what encodes the genetic information. And when we're talking about genes, genes are the segments of DNA that contain information for making the proteins. And proteins is what make up all the building blocks of life. And so it's these changes in genes that ultimately can lead to cancer development and growth. And so when we are talking about driver alterations or biomarkers, as Dr. Marks had talked about in her presentation, driver alterations are those changes in the DNA that can cause normal cells to become cancer cells and lead to cancer growth. And as Dr. Marks had talked about in her presentations, there's different driver alterations. So there are gene mutations, which is a change in the nucleotide or the building block of DNA. Gene mutations can be seen, in EGFR mutations, KRAS mutations. Other driver alterations also include gene translocations, also known as gene fusions or rearrangements. And this is when there's an abnormal rearrangement of DNA that connects two genes together. And some of the common gene rearrangements that we can see in lung cancer include ALK, ROS1, NTRK, and RET. And the other type of driver alteration is a gene amplification where there's an extra copy of a gene. So this is, some a chart that Dr. Sen had also included in her talk. But this is just demonstrating how in lung cancer, there are a number of driver alterations now that can be found in lung cancer that can cause lung cancer. And this is just highlighting how these driver alterations exist. And it's important for us to see if our patients harbor any of these alterations because they can impact what therapy we ultimately recommend. And this is just taken from the cancer guidelines from the National Comprehensive Cancer Network, just to really emphasize how it is important to do molecular testing because, it began in the advanced or metastatic setting where we were really utilizing targeted therapy in patients who harbor driver alterations. And as Dr. Marks had mentioned in her talk, we're starting to use targeted therapy in the early line setting. So molecular testing is certainly becoming important across all stages of lung cancer because this really can influence the treatments that we recommend for patients who have lung cancer.